Now, it's looking like the surge in COVID, flu, and RSV is making it harder to find the over-the-counter medication used to fight them. In short, supply is not keeping up with demand, and particularly for kids. Today, both Walgreens and CVS told NBC News that that's exactly what they're seeing, confirming that fever and pain-reducing medicines like children's Tylenol and Motrin have been difficult to find in recent weeks. And this isn't officially recognized as a shortage. That's something that's designated by the FDA on their website. And for now, they're not saying that that's not the case, but still, there's worry that this lack of access could lead to an increase in emergency visits. Joining me now is NBC News medical fellow Dr. Akshay Syal. Doctor, how serious is this shortage?
Good evening, Gadi. Good to be with you. It's a complicated question. Like you said, the FDA hasn't officially acknowledged a shortage of the medications, yet at the same time, we're seeing photos of the empty shelves, a little bit reminiscent of what we saw, when the pandemic first hit, when people were hoarding toilet paper, frankly. And so, what the concern is that we aren't yet at the peak of these respiratory viruses. Flu doesn't even peak until typically December to February. So as these viruses are going to keep growing and increasing in circulation, are we going to see those medications return back to the shelves? That's what's the big question right now.
And we've got this supply chain issue, possibly. What kind of strain is this going to put on pediatric healthcare providers?
So I think the big concern here is that a lot of these medications allow you to break your fever at home. And if you don't have these medications, you may not be able to break that fever as effectively, and you may go to an emergency room, or you may go to an urgent care or a doctor's office to get treatment that you otherwise could have gotten at home. We spoke to a mom and a doctor about her son's experience in going through all this. Take a look at what she had to say.
When I saw the shelf, I was just in shock. And it just reminded me of, how bad things were in 2020 when you couldn't find toilet paper, except now as a mom to a sick kid with a fever at home, I was struggling to understand, here we are. Nobody seems to care that you can't find basic medications.
So I'll add that, Dr. Aurora, who you just heard from, her son just recovered from RSV and now has a case of COVID-19. So, this is something that unfortunately we may hear more of going forward. And it's really important that we get some more transparency as to when these medications will be back on the shelves.
Absolutely. And there's such a big difference between toilet paper and Tylenol or children's Motrin when your kid has a fever of 101, 102, and you're terrified about what's going to happen. Is there any sign of this easing anytime soon?
Both manufacturers are saying that there's no official shortage, as the FDA is as well. But with the pharmacies saying that we are seeing the increased demand, we're kind of in this complicated situation where we don't exactly have a transparent view of what the supply looks like. I should add, though, for parents who are concerned, parents who want to, get some care at home and can't find these medications, there are some other things you can try. If you're having a stuffy nose or nasal congestion, as we say, you can try a saline rinse. If you're having a cough, some people get relief with honey. So there are other things you can try. But if you are looking for a way to break that fever, give your doctor a call if you can't find the medications. He may be able to prescribe something else.
Dr. Akshay Syal, thanks so much for making the time tonight.
Anytime.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.